Collectively, Ashley Graham, Brianna Herbalario, Christine Panulier, Katie Vu, and Nicole Wager are the epidemiologists who research syphilis and will be presenting the prevalence of syphilis within adult males in the United States from 2003 to 2018. Syphilis is a sexually transmitted infection that can cause serious health effects such as death if not properly treated. For our presentation, when P and S is used, it refers to primary and secondary syphilis. Syphilis has long been a public health issue, and in 2017 alone, there were more than 100,000 new cases of syphilis reported, more than double the number of new HIV diagnoses. Now I will go over the extent of the problem, first discussing morbidity and mortality. Morbidity is the development of an illness within a population. In 2017, the Centers for Disease Control and Prevention estimated an average of 9.5 diagnosed cases per every 100,000 people. This is a 10.5% increase from the previous year in 2016, where there was 8.6 diagnosed cases per every 100,000 people. The mortality rate is the number of deaths within a population in a given time or location. The mortality rate of syphilis can range from very low to very high depending on treatment. Syphilis can be treated very easily by penicillin injection, and afterwards it can no longer continue to harm a once infected individual. But if syphilis remains untreated, there can be an 8% to a 58% mortality rate, with the highest rates among males. For the economic impact syphilis has on the United States, it can vary depending on what type of syphilis needs to be treated. The direct medical costs of syphilis, including primary, secondary, and tertiary syphilis, are about $715 per each case. The indirect costs are about $140 per case. The medical costs per each case of congenital syphilis, on the other hand, are much higher. The direct medical costs are about $8,424 per case, and the indirect costs are about $75,000 per each case. Discussing the temporal variation, rates of syphilis have fluctuated up and down throughout time. Starting back in 1941, the number of reported cases of syphilis had reached epidemic numbers. Then, in the 1990s, there was the lowest number of reported cases of syphilis ever. And finally, starting in the year 2000, syphilis rates have risen every year since. Geographically, syphilis has had the highest rates reported in the West with 13.2 cases per 100,000 people, and has the lowest rates in the Midwest with 6.2 cases per 100,000 people. In California especially, the number of cases of primary and secondary syphilis and congenital syphilis are the highest in the nation. From 2012 to 2015, the number of cases of congenital syphilis had quadrupled in California. In terms of endemics, African American men are far more likely to have syphilis than any other race, with the greatest disparity being 4.5 times more likely than non-Hispanic white men. Looking at this graph that shows the rates of syphilis by region, you can see that syphilis rates were lower in 2008 and have increased each year until 2017. The West used to have lower rates of syphilis and has since passed the rates in the South and now has the highest rates of syphilis in the United States.